Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned, not-for-profit hospital. I'm bringing you programs that will provide information about health issues relevant to our community. We will have physicians and healthcare professionals on the program that will tell you how to prevent those issues or to get help if you already have them. In addition, we are pleased to introduce Medical Alert, announcements from the Mayo Clinic, a partner of KRMC. As you all know, there are enormous challenges that are facing healthcare today, from increases in our insurance premiums to state cutbacks to access and Medicare. The average consumer is scrambling to try to ensure they have good health coverage. Now more than ever, it's important that we all take responsibility for our health. Prevention is the key to staying healthy, and I hope that these programs will help you learn how to become a healthier individual. The topic for our program this week is healthy eating. My guest today is going to be Rachel Head, registered dietitian from the Diabetes Education Department at Kingman Regional Medical Center. We'll be right back after these messages to meet Rachel. Welcome back to Your Health Matters, brought to you by Kingman Regional Medical Center. Our topic today is healthy eating, and my guest is Rachel Head. She's a registered dietitian from the Diabetes Education Department at Kingman Regional Medical Center. Welcome, Rachel.
Thank you for having me.
It's great to have you on the program. So, dietitian, tell me, what does that mean, and how do you become a dietitian, a registered dietitian?
Thank you. Dietitian is basically somebody who loves talking about food, and that would be me. I really just enjoyed my nutrition class in college and decided that that was what I wanted to do, so that I could help other people with some of the issues that I was experiencing with food. To become a registered dietitian, you have to complete a lot of coursework, as well as an internship with about 1,000 hours of practice in the field. And then you have to sit down and take an exam and pass that exam to become nationally registered.
Very good. Now, where did you go to school?
Texas Christian University, Go Frogs, in Fort Worth, Texas.
Very good, very good. And how long have you been here in Kingman?
I have been here since October, so a little over 6 months.
All right, well, welcome. We're glad to have you as part of the KRMC team. I know you filled a big gap, and it's good to have you here.
Thank you.
So you must enjoy cooking.
I love cooking.
Good. Well, and I love eating, so we could be really good friends. I've got a segment I want to show you that is from Mayo Clinic's Medical Alert. It's called The Art of Healthy Eating.
Sounds good.
Let's watch it.
It's a bad habit just about all of us do. We wolf down food without paying attention to what or how much we're eating. Wellness experts at Mayo Clinic started a course to help people get back in touch with food. It helps you slow down, enjoy the experience, and eat right. They call the course The Art of Healthy Eating.
Enjoy food for really what food is, satisfying your mind as well as your body.
Wellness coach Carlia Bradley says that's the philosophy behind Mayo Clinic's Art of Healthy Eating program.
Not thinking of it as good or bad food, not thinking of it as a should or shouldn't, but really just enjoy what is food, what's the texture, what's the smell, where do I feel truly satisfied.
The class focuses on 4 main ideas. First, recognition.
Recognizing where your hunger is when you begin eating, whether you're famished or not. Recognizing how full you want to be at the end of your meal.
Second, satisfaction. Choosing foods that really satisfy you.
I like the colors and the variety.
Third, ambiance. Use real dishes, dim the lights, make the environment inviting with minimal distractions. And fourth, appreciate the occasion, the people around you, and take a few breaths before you begin. Take time to pause during the meal to think about how you feel at that moment, how full you are, if you like the food you chose. It's not about weight loss, it's about improving your relationship with food. But most people who take the course drop pounds. They're in tune with what they need, so they eat about 1/3 less.
Leah, Lizzie, can you come set the table?
Laura Vries Spencer is a cancer survivor who takes what she learns in class home.
And once I learned to eat better, I felt better.
She's teaching her daughters how to enjoy the art of eating.
A way to make my foods exciting is I pretend that the broccoli is trees, my milk is a swimming pool, and potatoes are clouds.
Learning to eat to nourish body and soul. Laura says even on the days she and her girls have to eat on the run, she tries to take time to think about what will satisfy them. She also tries to make every meal a time to pause, relax, and spend a little time with her family. For Medical Edge, I'm Vivian Williams.
So what do you think of that, Rachel? Is that pretty appropriate to what you are doing?
It's very appropriate.
Okay.
I get a lot of these same issues with people who come in and talk to me about their nutrition concerns.
Mm-hmm. And what do you do to help them with that?
Well, basically what we see is that there's a problem of convenience in our society. We've got a lot of people who are on the go, who don't have time or money for healthy eating, they think.
Right.
And convenience actually comes at a cost, a significant cost, because that basically leads us to choose less healthy options with our food.
So you're talking like fast food, obviously.
Fast food, something quick, something cheap, but it's cheap and it's quick for a reason, and that's usually not good for our health.
So even, I mean, we're not even just talking fast food restaurants, we're talking the fast, like macaroni and cheese, you know,
something
the box
frozen,
foods.
you microwave it for 2 minutes and it's done.
Right, and I know I can be just as guilty of that myself. Like you said, you're always on the run. So you help people find alternatives to that?
Right, and I believe there's a time and a place for those things, definitely, but more often than not, I like to bring more attention back to real food, because you have more control that way. If you're cooking at home, you've got control over portion sizes, you've got control over ingredients, and you've got control over cooking method.
Okay.
Where anytime that you give that control to somebody else who's trying to make a profit, they're going to make it taste good, and they do that by adding more fat, more salt, more sugar, more calories.
It's those additives and the preservatives, obviously, that don't do us too well.
Exactly.
I know for me, they go right to the hip.
Right.
Well, so what kind of programs or services do we have here in Kingman to help people with that?
We actually have a lot of resources. We have one-on-one counseling with me in the outpatient setting, basically just getting to know what the situation is and coming up with solutions for that, for particular circumstances. If there is some kind of diagnosis, you can look into getting a referral from your doctor to come see me for weight issues, high cholesterol, those kinds of things. We do have a fully comprehensive program for diabetes, so if you've got blood sugar control issues, you can come get some help for that and reduce symptoms and complications that way. We also have a more preventative aspect of this. We've got a cooking class that's ongoing where we focus on supplying those skills, those essential cooking skills and know-how in the kitchen, giving those back to people so that they can cook at home.
My granddaughter and I just did that last week, I think it was, right? Or the week before.
Right, it was a lot of fun to have you.
It was fun to learn the different cooking techniques and to try all that. That was the best part too. We got to eat it as well. So
Right.
it's not like watching the shows on TV and then you don't even get to taste it.
You don't get to try it.
You get to smell it and taste it and enjoy it, and it was healthy too. I think we had a black bean burger, which I have to admit, if someone had told me I would like a black bean burger, I'd have laughed at them because beans are not high, legumes are not high on my favorite list of foods, but it was delicious.
I'm glad you liked it.
It's
and
really good.
Also, you know, we talked about how to make it in different ways so that if you weren't satisfied with the way that we made it, if you wanted a different texture, a different taste, you have a lot of options. So
right,
it's,
yeah,
it's
you
really
said
working on
recipes
your
home with us too, so with all those different ideas, that's great. So you mentioned that you could get a referral, so does sometimes insurance even cover some of the costs of
Definitely.
these programs?
Insurance realizes, the insurance companies realize that it is in their best interest to make people healthier. So coming to see a dietitian for whatever reason that is, having 5-10 extra pounds, higher cholesterol levels, anything like that, coming and working on that can really be beneficial to your health.
Absolutely. Well, I know for myself that because I was insulin resistant, so I was like early stages of diabetes, and was actually on some meds for it, and losing the weight through changing my eating, which was Like I said, I mean, I've always said that fat and full are the two worst things that God ever gave us. 'Cause to me, that would be paradise on earth if we could eat everything we wanted and never be fat and never be full. But obviously that doesn't work.
Yeah, I mean, it's not particularly fair, but at the same time, our philosophy in the nutrition department here, the outpatient nutrition, is one where I'm not just sitting across from you and handing a diet to you that I think is best for you. It is working with you how you currently eat, your lifestyle, your food preferences, and just looking at making minor changes so that
it's really individualized
right, it is.
to the person, and that makes a huge difference. It really does.
It makes you more motivated to want to do it, but it also makes it easier to keep up long term. Whereas, you know, diets that we go on by ourselves, you know, it's hit or miss.
And it's focusing more on positives than negatives, because I think when you are focusing, oh, I can't eat that, and I can't eat that, and I can't have this, instead of, oh, I can have this, and I can eat this, you know, the focusing on what you can have, not just what you can't have, makes a huge difference.
I agree.
And having that support system as well. I mean, I know for myself that was a big thing when I, you know, actually started working out with a trainer for a while, and having someone I was accountable to made a big difference for me.
Right.
To be able to focus on that. And I know that the classes, like you said, some of those are, we just had one a couple weeks ago, so if they are interested in future classes, they can call you?
Yes,
right?
definitely. They can call the Wellness Center front desk to get all of the information about any of the nutrition classes, cooking classes, diabetes program, outpatient counseling, and that number is area code 928-692-4600.
Right, okay, very good. So 692-4600, that's the Wellness Center, and then they can just ask for more information about diabetes education,
right?
Nutrition, or ask for you if
exactly.
you're available. Okay, that's good. I know we've talked a little bit too. We have a health fair coming up in November that's focusing on diabetes.
Right. So if you have diabetes, you definitely don't want to miss this event, because we have many resources locally and throughout the state of Arizona who are going to come in and bring their information, their products. So just a lot of free goodies and good information and good support.
Great. Well, we're going to want to talk a little bit more about that in a later segment here, but we're going to take a little break for a few messages, and then we'll be right back. Thank you all for joining us. Stick around. We've got some more information for you.